A very good evening to all of you. I'm Dr. Sumit Dikshit from SPA, and I want to welcome you all for this webinar on the topic Count Proteins, Not Calories. Before we start, I would like to say thanks to respected RM Joshi sir, who accepted my request to take this topic, which is very important. And there are many myths which are uh, common among the medical fraternity as well. So this topic is very important, and who could have been better speaker than Dr. RM Joshi sir. So thank you sir for joining us today. And I would like to say thanks to respected Lakshmi Gupta ma'am as well, who she is very senior and batchmate of Joshi sir. So welcome, ma'am, and all of you who have joined and spared their time out of their busy schedules to for this webinar. And without any further delays, I would like to start the webinar. And I would like to say thanks to Miss Lavanya as well. She is a functional nutritionist and longevity consultant based in Hyderabad, and she will be the moderator for the session today. So now I hand over the mic to Miss Lavanya. Okay, thank you everyone, and I hope that this webinar will be a myth buster and will definitely help all of us to clear our concepts, and this will help for our daily routines for ourselves and for our patients and for the community people as well. So over to you, Miss Lavanya. Thank you.
Thank you, Dr. Sumit. So good evening all, and welcome you all for this today's webinar, Count Protein and Not Calories. I'm Lavanya, as Dr. Sumit have already explained. I'm very thrilled to be part of this and also to be the moderator for the evening. And before we could get into what is this all about, a small piece of information. We talk about protein a lot. So, today in India, given that we speak about protein a lot, but still 73% of the population in India are deficit in protein. I would say it is a very silent health crisis. And given this piece of information, please join me in welcoming Dr. RM Joshi, who will be guiding and navigating through this topic. Welcome, Dr. Joshi. He's an MBBS MD, 1988 AFMC Pune. And Dr. Joshi brings 34 years of experience in Medical Corps of the Army service, serving in various capabilities as a clinician, health administrator, health advisor to commanders, hospital administration. And I'm very happy, sir, you have a very wide exposure and experience. And also, he has commanded two hospitals. One is field hospital and other one is military hospital. Both were awarded as best units in 2011 and 2023. Post his retirement, he is actively participating in spreading awareness among nutrition and its aids in application to prevent and treat chronic diseases. Dr. Joshi is also contributing to this field through his publications. He has published several papers under Medical Journal of Armed Forces of India, MJAFI, and he also runs a YouTube channel by the name Poshan Shiksha by Dr. RM Joshi, and also website is www.poshanshiksha.com. He is a physical fitness enthusiast himself, talk about, Poshan a lot, and then he's actively participating and living as an example. He has recently participated in AIDS cycle rally in 2005, covering 6,000 kilometers in just 1 month. And with all that, it's not just about the talk, he lives an example by himself. I'm so happy in welcoming you, Dr. Joshi. Over to you. Please go ahead, please. Yeah.
Thank you, Lavanya, and thank you, Dr. Sumit, for a nice introduction. It's always you feel good when somebody praises about you.
Yeah.
So I hope that I should be able to live up to your expectations. Now, before that, I just want to share my own story with you. What happened? As an army, you said I was a very fitness freak. I was very fit, and we all followed those guidelines which has been given in our books, in the true spirits. For 25 years, I didn't take any butter, any cheese, any high saturated fats. Then physical fitness was one of the key goals. But I got a shock in 2020 when I first had a severe chest pain. Severe pain. It was akin to a MI or a myocardial infarction or heart attack. And then angio was done, and it was found that there is a 95% block in my left, in my one of the coronary arteries, LAD. That gave me a jolt of the lifetime because I thought, even after having strictly following those guidelines, how come I got it 95% of blockage? So I said, let's without instead of blaming the genes, I must explore the alternative routes. And since we are living in a very good times of internet, and then I started exploring the world of nutrition myself. And I was surprised to see that what we have taught and what is given in alternative view is total different. And after that, it evoked the interest in nutrition, and then now I have now dedicated my life to spread this awareness about nutrition in my own way, as per my exploration, my research, you can say my studies, something like that. So without wasting time, I will now straight away head towards the webinar. Now in this present century, in our time, the lifespan has increased, and there is no doubt that we are living much longer than what we used to our ancestors used to live. But there's a catch. Lifespan has increased, but health span has decreased. This is worrying. So disease which usually occur during 7th and 8th decade are now occurring in 30-40 age group, and there's a gradual shift to adolescent and screen children. I had a YouTube video on this topic that हमारे बच्चे क्यों बीमार पड़ रहे हैं. If you are interested, you must watch the projections. What is the state of our children getting diabetes, our children getting hypertension, and so on diseases. Now, second thing is that to understand nutrition and longevity, we have to consider human body is a computer system. We have now the computer systems for past 10-20 years, but our body is an advanced computer system since ages. For example, any computer systems require hardware. So various systems like cardiovascular system, respiratory, musculoskeletal system, nervous system, etc. They are the hardware of the body. And then communication systems are the software like nerve impulses, how they go, hormones, enzyme, etc. They are all software. Instead of AI, the body has I, that is, body has got its own inherent intelligence and machine learning capabilities. And this machine learning is not few years back; it is lakhs of years of machine learning, which we are, which the information is there in our brain system or in our system. Like a computer, human body also runs on algorithms, and the disease is a disturbed algorithm. Our body is equipped with thousands of 3D printers, and in our case, the inks are the nutrients and the cartridge is food. We know that we cannot insert HCl cartridge into some other brand like HP or Lenovo or something like that. So similarly, if there is a mismatch of cartridge, then there will be problem. And this body is unique that it can repair or make its own software as well as the hardware. That is the growth and repair part. So as an individual, our main job is to refill ink with proper cartridge. And our cartridge, as I said, is food. So we have been evolved to eat whole food with minimal processing like cooking or some chopping, etc. But unfortunately, today the processed foods or refined foods are the mainstay of our diet, and our body algorithms has been disturbed by these faulty with a faulty nutrition. Theoretically, if we say our body is such an efficient system that we can live forever if proper inks are supplied, that means nutrients are supplied regularly in a right proportion. In fact, we are living in the most exciting times where we can acquire a very, very long life, not just 70 years or 80 years or 100 years, maybe 200 years, 300 years. But we have destroyed our environment, we have destroyed our food system, we have destroyed our water systems, and also in this internet age group there is more of misinformation regarding nutrition than information. Now, uh, some shaking to the doctors. In fact, the health of our doctors, or I am a part of that community, is as bad as general population. Various surveys are there in which doctors are diabetic, 53% diabetic. This is Ahmedabad survey, 24% hypertensive and obesity. So my aim of presentation is to refresh your knowledge, number one, and make you aware that there is a gap between the knowledge you possess and practice, and also motivate you to improve your health, because charity begins at home. As we are aware, we have got five group of nutrients: protein, carbohydrates, fats, calories. They are called macronutrients. Vitamins and minerals are required in a very small quantity, so we call them micronutrients. This all we know. Now I just want to draw your kind attention. I just want you to write in the comment box that which of these macronutrients are very important. Give them 5 star. So, what are the nutrients group which deserve a 5 star rating? I'll just request you to write in the comment box, so that just kindly write on the comment box which of the groups they deserve a 5 star rating. Not more than 3 groups. So, your time starts now, and there's only 15 seconds will be dedicated to this exercise. Yeah, protein. Dr. Sumit Dixit says protein. Lavanya said protein. I'll request other participants also. So that's great. Most of you think protein deserve a 5 star rating. Followed by vitamins and minerals. That's great. So I'll just now we'll proceed further. So this is the star rating as per my assumption. The proteins that deserve 5 star rating, then vitamins and minerals 5 star rating, fats then 4 stars, and carbohydrate and calories they deserve 2 star or 1 star. This is totally opposite to what we are taught. The whole world The whole world is obsessed with cholesterol, fats, carbs, and calories. Whereas our body is major portion of our body is made up of proteins. So our body is made up of 60% water, 20% fat, and 16% of protein. And as we are aware, proteins are chains of amino acids. We require around 22 types of amino acids to thrive, and out of these 22 amino acids, 8 amino acids cannot be synthesized by the body. So we have to provide these amino acids to the body through the food. That's why these amino acids are called as essential amino acids, or EAA we can say. And as we are aware, proteins they are required for growth, repair, fighting diseases, and maintenance of body on a day-to-day basis. Now, what happens when we eat food rich in protein, what happens to the protein content in the food? So, proteins in food, it is broken down in intestine and absorbed as amino acids. These amino acids they circulate in blood, and cells they take amino acids from this blood pool, they take these amino acids as per their requirement, and whatever excess amino acids are there, they go to the liver. Now liver can also synthesize certain types of proteins, but remember, liver can only synthesize complete proteins. It cannot store proteins to that extent, and any excess amino acids that are present in your blood during that time, they will be used for glucose conversion of, or turned into fat or burnt. Now see, what happens when we different types of food groups are taken, like whey protein, or we'll say protein powder. These are purified amino acid derivatives. So they, a whey protein food will peak in within a 1 hour, 45 to 60 minutes, and then it remains, the amino acid, they remain elevated for around 3 hours. Similarly, egg is slightly more. When you consume egg, the amino acids remain elevated for 3 to 4 hours. That means they are released slowly in the blood. Then meat 5 to 7 hours, soybean or pulses therefore to 5 hours. Milk is primarily a casein protein which is very slow to digest. It takes 5 to 7 hours to remain elevated, and mixed Indian meal is also 5 to 6 hours. So this is important. This slide is important in the sense that nowadays there are too much emphasis on taking whey proteins or protein powders even by the general population. If your body doesn't require that high amount of protein in a short duration, it will be used, it will be turned into fat or glucose or burnt. So whey or protein powders by general population is of no use, much use for the protein as far as the protein requirement of the body is concerned. Now we'll discuss about protein deficiency. Now, as classically we have been taught in our books, or we have been taught during our MBBS days, that there are two protein deficiency state. One is marasmus and kwashiorkor. Luckily, these diseases are now almost not found, or are very rare. Maybe in some African continent where there is a famine or there is a absolute disaster like situation what is happening in certain countries, these type of clinical entities may be there, but not in a general population. So now let's divert our attention from proteins and come to Hyderabadi biryani. So Lavanya must be very happy to see. So let's suppose that you make, let's suppose Lavanya makes a very good biryani. So anybody going to Hyderabad can enjoy biryani made by Lavanya. So supposing your biryani is famous, and to make the biryani you use basmati rice of 1 kg and spices of 20 different types. So now unfortunately today neither basmati rice is not available, so you put it grade 4 rice, or that control ration wala grade 4 rice, and spices are also not there, so you add only 15 spices. Now will your taste and aroma of the biryani will be similar with this in these two cases or not? So answer, when you put normal rice and put lesser amount of spices, the taste and aroma will be different. It will not be as good as that what you used to make it by a basmati rice. So quality of biryani will now suffer, whereas quantity may or may not suffer, because after all we are making 1 kg biryani with a normal rice. So with suboptimal deficiency of proteins or essential amino acids in diet, the quality of all protein related structures like muscles, hormones, enzymes, bones, hair, nails, they will all they will all suffer. There will be problem. Now we know that proteins are required for muscle synthesis, but these amino acids are also required as for other functions, like tryptophan is used in making serotonin. Serotonin we know is a very important chemical. Tyrosine, dopamine, it's used to make dopamine and norepinephrine. The nitric oxide and spermidine, it is manufactured or is made from arginine. Now spermidine is one of the major activators of autophagy and longevity. then creatinine, then glutathione, porphyrins, DNA, RNA bases, all require amino acids for the formation. So now let's discuss what will so when there is a deficiency, all these functions will be affected quality wise and quantity wise. So first and foremost, sign, symptom or feature of the protein deficiency or a suboptimal protein deficiency will be recurrent infections. Now we defined it as an attack of cold or sore throat more than 6 times a year, or ear infection greater than 4 times a year. But because why? Because antibodies and phagocytes, they are all made up of protein. And once protein deficiency is there, the quality and quantity of these cells will be affected. And we have seen that children and elderly are most affected. So in case a child gets or elderly person getting recurrent attacks of infection, it's better to give him a high protein diet, and then later also in addition to the treatment which we keep on giving. Second, a posture. A good posture is a reflection of the protein status. When muscles are well nourished, they can hold the body in an erect fashion. And when they are deficient, then they lose elasticity and postures become poor. So a mother scolding her child to sit straight often is complaining of her failure to give adequate proteins to her child. Dr. Adelaide Davis, in her book like Let's Eat Right to Keep Fit, she has mentioned two cases. One case of a child having pot belly, sunken chest, flat feet. It disappeared within 3 months of high protein diet. And another case of a 60 years old woman. A high protein diet improved her posture as well as her ability to stand erect. This book is a very good book. It was written in 1954. But when you read it, you will find that it has been written yesterday only. Things what she has predicted, they are all coming true now. Now, because of the protein deficiency, muscles will be weak, bones will be weak. After all, bones also are also require protein. We think that bone is only calcium and vitamin D, but matrix is made out of collagen, and that is a protein. So, joint pains and backaches, non-specific type, will be common. Now, chronic protein deficiency will contribute to all sorts of old age problems like sarcopenia, osteoporosis, and resulting in falls and fractures. Sarcopenia is considered the hallmark of old age. But in my opinion, it is primarily a chronic protein deficit, a micronutrient deficit, maybe exaggerated by inactivity and other things. So I have made there's a video in my channel regarding sarcopenia also. Interested people can watch that video. Now there is a meta-analysis done in Nutrients published in the Journal of Nutrients 1924, which says that sarcopenia was much higher in a group which consumed less than 0.8 grams of proteins in comparison to the group which consumed around greater than 1.2 gram per kg weight of proteins. So higher the protein, the lesser is the risk of sarcopenia. And sarcopenia, as you know, it sarcopenia contributes to bad posture, loss of balance, recurrent falls. Even well-fed people may have high amount of sarcopenia, as we see. Recurrent falls and fracture, reduce mobility and diminish the quality of life. It may require hospitalization often. Urinary incontinence in ladies, especially older ones. It may be because of the weak urinary bladder muscles. Similarly, effect of protein deficiency on the alimentary system. Now, our alimentary system is again made up of muscles, and these muscles perform the very important role of peristalsis. Now, they push the food from esophagus till it is stool is thrown out. So, when there is a protein deficiency, muscles are weak. They are not able to push food to that speed, resulting food remains in the gut or intestine for longer time. The longer time means bacterial action, flatulence is common. That's why flatulence is very common in elderly people. And since the food is that stool or waste material is not pushed properly in proper time frame, then there is a constant there will be a constant complaint of chronic constipation. So
That's
now what
great.
happens now? So what we do if a elderly patient comes to us with a complaint of constipation? We generally supply laxatives for improving his condition. Now what happens is the already weak muscles are forced to do more work by these laxatives. So instead of giving recurrent and chronic use of chronically giving laxatives, it's worthwhile to try improving the protein status. And if the muscles are so weak, especially during rectum and anal canal, then there may be fecal incontinence also. So in such cases, a high protein diet becomes a very important thing. Now, second thing is collagen synthesis will be hampered. We know collagen is very important protein as far as formation of cartilages, bones, skin, connective tissues, hair and nail. These structures are affected in chronic protein deficiency. Like nail, it's very common. Nail, they break, they peel or crack very easily. Hair, the hair, they will lose elasticity and they break easily, and falling off hair may be due to protein lack or deficiency. In fact, I have seen on myself, when I have improved my own protein intake, I have seen my hair fall has reduced substantially. So wrinkled skin, again, it may indicate protein or collagen deficiency. But nowadays there's a market. There are a lot of supplements claiming that collagen supplement they improve skin and their hair textures. And lot of YouTubers or other influencers, they cite large number of articles which prove that yes, it was done. So I also just checked one of the studies which was cited, and it says that collagen supplement increase skin hydration, elasticity and so on. Very, very impressive way of writing. But when I did a post-mortem of the study, I found that this study is a flawed. So those who are interested to check, they can see my article in poshanshiksha.com, in which I have said what are the flaws in these studies. So most of the flawed studies are propagated as a good study or and as a support to take collagen supplements. After all, when you take a collagen supplement, it will be ultimately broken down into the amino acids and then absorbed. Not that if you take collagen supplement, it will go to straight away to the nails, it will straight away go to the hair and so on. Now hormones are made up of proteins. So nowadays hormonal disturbance is very common. Thyroid dysfunctions, menstrual irregularities, they become more common. So improving proteins intake may be one of the answers. Blood clotting, it requires protein. Chronic fatigue, anemia, wound healing, they all be affected in protein deficiency. So with this, we'll come to the next part, that is sources of protein, which most of you are well aware. But it's just a recap of what we do. We know that there's animal sources as well as plant sources. Meat is a very good source, having 25 grams of protein per 100 grams. 100 grams of eggs means 2 eggs. They have around 12 grams of proteins. Then skim milk powder is very good source, 38 grams per 100 grams. Fish is another good source, that is 30 to 35 grams per 100 grams. And among the plant sources, pulses, legumes are very rich source akin to meat. The soya chunks, almost 100 grams of soya chunks gives you around 52 grams of protein. So soybean and soya products are good source of protein. Then another group is the cereals. Maize, which is eaten in Punjab, especially during winter seasons, it gives you around 11 gram protein. Wheat, a stable diet of North India, it gives you 12 gram of protein per 100 gram. But for rice eaters, they must understand that rice have lower protein content. It is almost half that of cereal like wheat and maize. So rice eaters must compensate this protein by either taking more or adding some other protein foods to their diet. Second important is the quality, which we are all aware. Now we have two types of proteins, that is one is the complete proteins and other is the incomplete proteins. Now complete means all essential amino acids are present in that protein food. And for all practical purpose, all animal proteins are complete. And egg and milk proteins are also known as reference protein. Well, incomplete proteins, they lack few amino acids, or the concentration of that may be much lesser. So for all, a general rule, all plant proteins are incomplete and they have got a poor bioavailability. For example, cereals and millets, they lack an amino acid called as lysine, and pulses lack methionine. There are some exceptions to this, like soybean, quinoa, amaranthus, in Hindi we call it ramdana, buckwheat, that is kuttu kata or kuttu, chia, spirulina, hemp seeds, they are all complete proteins. But there is a problem. Vegans can use these food items in their diet to improve their protein content, but there's a problem. These are very costly. For example, a ramdana will cost you around 250 rupees per kg. Quinoa again 310 rupees. These are I have gathered it from the Amazon. So they are very costly items and beyond the reach of a common man. So commonly, so improve to improve the protein content, vegetarians and vegans, they must combine pulses, legumes and cereals or millets in any meal. The ratio is recommended ratio is 3:1. Now what happens when incomplete proteins are consumed? Like we consume roti sabji, or some people may say having a rice with ghee or rice with some vegetable curry, something like that. So first thing, liver cannot make proteins, proper proteins, if essential amino acids is lacking in the meal. Now whichever is the least amount, that will dictate the amount of protein formed in the body. And liver also doesn't store any incomplete proteins. And all those surplus amino acid will be go to, as I said, will go to liver for conversion to glucose or fat, or they may be burnt for energy. So if you take a roti sabji in the morning, then I think major part of that will not be there for the protein formation. It will be for fat formation or a glucose formation for energy, which is a very costly affair. Now there is one common action or common thing advised by doctors when they prescribe a high protein diet, that to their patients, especially cardiac patients, they say remove yellow portion and eat only white portion. Now this practice, we will not discuss about yellow, what merits and deeper controversies. Let's like to take in an egg 50% protein is there in the white, that is albumin, and 50% protein is there in that yellow portion. So if you remove yellow portion, you have first thing, the protein content has been brought to half, that is instead of 6 it is 3, and then you have converted a complete protein into an incomplete protein. There is a loss of tryptophan, which is there in egg yolk, is a major source. Tyrosine, phenylalanine, cysteine, methionine, and certain branch amino acids like leucine, isoleucine, and valine. These are lost if we remove yellow portion of the egg. And I am not talking about macronutrients loss. So if you take a white only, then you are converting a high protein, high class protein into a incomplete protein, and of course you are getting devoid of the macronutrients. So this practice must be stopped. If you are doing it, kindly eat full egg, both white as well as yellow. Don't worry about the cholesterol. We will discuss the cholesterol in some other session. There are a lot of controversies in this theory or this in cholesterol hypothesis, which we will not discuss today. So as far as protein in our diet, there are two types things must be checked. One is quantity. What is the quantity of protein in our diet, and what is the quality of protein in our diet? So quantity, like ICMR says, we should take 0.8 gram per kg body weight of protein. Now one must remember, first thing, this is to prevent diseases. Is a minimum protein requirement to prevent diseases, not to promote health. Number one. If you want to remain healthy, then at least 1 gram per kg body weight of protein should be there. And children and elderly should take slightly more, that is 1.2 to 1.5 gram per kg body weight. So as a general principle, we should take around 60 to 70 grams of protein per day, and each meal contains should contain about 25 to 30 grams of complete protein. This is important, complete protein, not incomplete protein. And when there is illness like fever and old age, it should be protein should be increased in diet. So now question comes up, are you getting enough protein? Are you taking enough protein in your diet? So another one small task to all of you, just write down the comment box whether you are taking adequate amount of protein in your diet or not. Can we have comments from our esteemed participants? Okay, Vivali says not complete. Yeah, we want some not regular, not complete, not complete. Yeah, Sushant says not complete. Lakshmi ji says no. So most of you agree that you are not taking adequate amount of protein in your diet. But the question is that what stops you? We have got the knowledge to improve our diet. So let's see. Now, since most of you has agreed that you don't take adequate amount of protein, I think with this, okay. Now, if health is to be maintained, both the quality and the quantity of protein must be ensured. Number one, and a person must know or learn the amount of protein they need and the grams that are supplied by our ordinary foods. Since the complete proteins are often expensive, poor are most likely to suffer. But but rich also suffer due to ignorance. A research published in the ICM by the ICMR says that 70% of urban rich people in India are protein deficient. So, but with good knowledge, adequate protein can be obtained even with limited budgets. That is the crux of that is the importance of knowing the proteins. Now, if one must understand that health of the individual cannot be built until they learn the amount of protein they need and the grams of protein or content supplied by the food. So as I said, an adult should take around 25 to 30 grams of protein per meal. So these like men should have around 70 grams of proteins, women around 60 grams of protein. Then pregnancy and lactation, we know that they require more protein than normal. And if we convert this is, so 50 to 60 age group should have at least 1 gram per kg body weight of protein. So a 70 kg person should have 70 grams, and 3 meals minimum 25 grams of protein in each meal. A person 60 to 70 age group, they should have 28 grams, and greater than 70 is 5 grams. So adequate protein intake means your quality of protein is good and the quantity is also adequate. This is important. Now, a quick recap of protein these foods again. Meat contains around 25 grams, milk 100 ml gives you 3 to 4 grams, eggs 12 to 14 grams, fish is very good 30 to 35 grams, paneer is 14 grams, then atta 12 to 13 grams, rice is 2 to 4 grams, soya flour is 40 grams, pulses around 20 to 25 grams, and groundnuts or mufli they contains 25 grams. And we must know that cereals lack lysine and pulses they lack methionine. Now this is the approximate value of cooked preparation. Sources NIN. We don't have to like folks. We'll discuss few items only because list is long. Like rice, 100 gram rice, which is 1 katori, gives you only 2 gram of protein. Khichdi gives you 4 gram. Pulao maybe 150 grams, or 1 katori pulao gives you only 5 grams of protein. Paratha, which is a very popular food in North India, it gives you around 4 gram of protein. The weight should be around 50 grams. Then fulka 3 grams, puri is 2 grams, dal is, you can see, is a 10 grams. 1 katori dal gives you 10 grams. Then dahi vada, again dahi vada gives you much more, 11 grams. Two pieces of dahi vada, they gives you 11 grams. Similarly dosa, two pieces of dosa will give you 6 gram, idli 5 grams, and so on. So these charts can be shared, will be shared in the group, so we need not mug it up. The second, one important consideration is that your breakfast should be high protein, not high carbohydrate. Why? Because number one, it improves muscle synthesis, it adds to the satiety and therefore appetite control. It controls the blood sugar fluctuations are minimal, there is a fat loss and improved cognition. While if you have a high carbohydrate breakfast, what happens? When we take high carbs, it's basically sugars, then there is a spike and insulin action and then they crash. It goes below the normal level, you feel much hungry. While protein stabilizes the blood sugar for 3 to 5 hours. A carb heavy breakfast also causes post meal sleepiness, while protein rich breakfast will give you adequate amount of energy. Now, since everybody has accepted that they are not taking protein, so that is not a myth now, it is a open secret. So, we'll just analyze a common Indian breakfast of two roti or paratha and one katori sabji. So one roti as per the chart gives you around 3 grams of protein. So total there is a 6 gram of protein from chapatis, and one katori sabji will give around 1 gram only, not more than that. So total 7 gram of proteins has been taken in the breakfast. Whereas we have targeted around 25 grams of protein. So there is a deficit of 18 grams per meal. You can imagine how much is the deficit on a daily basis. And this protein is a poor quality protein because cereals they lack lysine. Thus, a breakfast of two chapatis or roti sabji is a inadequate or incomplete protein breakfast. It is high in carbohydrates and protein synthesis will be minimal. This must be remembered. So even if you take ICMR conservative state, that is 0.8 gram, then still there is a 11 gram per meal deficit in this type of meal. No doubt, as the age progressive, sarcopenia sets in. Now we'll have a breakfast. I did a breakfast survey of SPA members, and these are the common breakfast which people are taking. Like upma, one person mentioned, I have taken upma, coconut chutney. Now, if you see, upma is nothing but white flour. So, suji is made from maida, and it's an incomplete protein breakfast. Fruits are there, but protein is only 7 grams in this breakfast, very less. It is a low protein, that too an incomplete protein, and high carbohydrate breakfast. The next is potato, vegetables, two katori vegetables, and chapati 3. It is 9 grams only. Quantity is around 10 grams of that too of incomplete protein. Then 200 grams of dalia, again incomplete protein. If they have put some milk, then slight improvement, but majority portion is incomplete. Then roti 2, omelette 1, aloo bhujia 1 katori. Now here omelette has been put up, so we can we take it as a 2 eggs omelette. So 6 gram of good quality protein. Rest are incomplete proteins. Methi paratha 50 grams of curd. Now 50 grams of curd is a very less dose as far as protein is concerned. Besan chilla we don't know, but we know that these are all incomplete proteins. None of the members it took high protein breakfast with at least 25 gram of protein. So most of the members, the breakfast was high carbohydrate. Then I did another survey in from previous webinars, and I found only 1% who said that yes, he took 30 grams worth of protein on that day. That means he took 4 idlis, 2 eggs and 1 glass of milk. Rest other people, the breakfast was low protein breakfast. Now, common Indian breakfast from the protein intake point of view or quality and quantity, like if you say paratha sabji, each standard paratha gives you 4 grams. So 6 parathas are required for 24 grams of protein. And that too, it will be an incomplete protein. So this is not a good breakfast as far as protein is concerned. Dosa idli. Now dosa idli, if it is from batter of rice and urad ka dal, then quality is good, and 2 dosa will give you 6 gram of protein. So you have to take large amount of dosa to get that adequate amount. Similarly, misri roti, is better because it's a mixture of a dal and a cereal. So protein quality is satisfactory. Dalia sweet, again incomplete protein. Dalia namkeen, again incomplete if there is no pulse or legumes or peanuts. So in dalia, namkeen dalia, we must add peanuts oblique some pulses or legumes to make it as a better quality protein. Sattu paratha is consumed in the Bihar area, and this is a good because sattu is dal. You add a cereals mixture is good, but then you have to take large amount of 2 to 3 or 4 parathas to get that adequate amount of protein. Dal chawal. Now dal roti, it's a common man Indian food, and it is very, as far as the protein quality is there, it is satisfactory. Now best breakfast will be those who can take or those who can afford is that you take 2 eggs and 1 glass of milk in addition to whatever you want to take. That this will alone give you around 19 or 20 grams of protein. So around 75% of protein intake can be taken. Now, if you are a vegetarian, you don't want to take eggs, then at least 2 paratha roti, 1 katori dal is a must, and 1 glass milk is a must to improve your protein intake. Now, worst breakfast, bread, jam, and cutlets by vegetarians is a worst breakfast because it's only there is no protein, almost nil, and it is incomplete. Protein content is very low and is a very high carb. That too are processed carbs. People take commercial fruit juices thinking fruit juices are very healthy. Commercial fruit juices are nothing but sugar. Bakery products. Now, breakfast cereal. We give breakfast cereals to our children, choco chips, and I don't know how many brands are there. Every brand says that this is very healthy, it is high in fiber, but you are giving only sugar to the children when you serve them breakfast cereals. Certainly, pasta, macaroni, semolina, suji, malted foods, they are all incomplete proteins, low content, and high sugar. So, if you want to know about these more, then there is a video that carbs are making us sick in my channel. Now, pure vegetarians, those who doesn't take eggs or vegans, those who even take vegans, they don't take even any animal product. They will have protein deficiency unless planned properly. Now, animal sources of proteins are the must to improve the quality as well as quantity because number one, they are complete source. Second, animal sources are protein dense. For example, 2 eggs and 1 glass of milk alone will give you around 19-20 grams of protein. So, if you take through plant sources, the bulk increases and we cannot eat that amount of stuff. For example, if you have to take roti sabji only, you have to take 6 chapatis or 5 chapatis, 5 rotis in the morning with 1 katori dal, which becomes too much of a bulk. So, we Indians, being vegetarian, should consume eggs or milk products liberally. If you can eat fish meat, it's an advantage, not a disadvantage. And for Indians, common protein sources will still remain with cereals, pulses, milk and milk products, and eggs. These should be added to the diets to improve quality. Now, protein and vegetables are minor sources of protein. Now, how to improve? The quality question comes up. So, cereals and millets and pulses should be eaten together in the meal. Prefer whole wheat atta, then prefer to branded atta or maida. Now, vegetarian must consume at least 1 liter of milk or milk products, and 2 eggs if possible. That alone will give you around 47 grams of protein. Now, egg should be eaten as a whole egg, both white and yellow, not just white. And organ meat is better than lean meat. Lean meat is, as far as nutrition is concerned, lean meat is very inferior to organ meat, and we teach our people don't eat organ meat, eat lean meat. So complete protein sources like soya chunks, buckwheat, quinoa, amaranthus, they can be added if possible to get protein from variety of sources. Now processed foods, maida preparation full of sugar and low proteins, they must be avoided in breakfast or as part of the diet. Now let's come to certain myths about proteins. Is that I take enough proteins, which we have seen, I don't take enough proteins. The other is that plant proteins are better than animal proteins. Again, it's a myth because plant proteins are incomplete and they are having a poor bioavailability. then animal sources are full of saturated fat and should not be consumed. I think now this thinking has to change. We should consume animal sources of proteins without fearing fats and cholesterol. Now, some people think then fruit, vegetables, and green vegetables, especially vegans, they said they have got a very high content of protein, which is not there. If you see, spinach 100 gram only give you 2.9 gram. Amaranthus. So, for all practical purpose, fruits and vegetables should contribute to the protein, but they cannot become the main source of protein supply. Then vegan diet is best. Vegan diet, in my opinion, is the worst diet. It's a fad because it is not possible to get large amount of nutrients from a vegan diet unless you have got some nutritionist to plan for your diet. Now dairy causes allergies. It is again a myth because in some people it may be there but not as a general principle. Then another myth which comes with the high protein intake which makes people not to take high protein is a kidney overload or damage, which is again a myth because now there are studies which says that kidney functions are not affected in a healthy individuals. If somebody is having a damaged kidney, it's a totally different matter. Then red meat causes cancers and diabetes. Again, this red meat cause is again based upon very flimsy science. So people have been consuming red meat since ages. Nothing happened to them. It is only a phenomenon of past 100 years when our food chain has totally changed. Yes, processed meat will be responsible for all these things. Egg yolk increases blood cholesterol. Don't eat it. Again, it is a myth because it is proved that eating cholesterol rich foods doesn't increase your blood cholesterol. I don't know how this has come into our thinking that cholesterol rich food should be taken. This we can discuss in some other webinar in which we discuss about lipids and fats. Protein supplements are good. Now protein supplements are not meant for a common man because there's a review article about whey protein consumption. These chronic use of whey proteins or any protein powder, I'll say, linked to liver and kidney damage, alteration in gut microbiota, increased acne, impacts on both mind and emotional. Second thing, when we take a purified anything which is purified, let it be a sugar or let it be a protein, it is absorbed rapidly into the bloodstream, very rapid. Now when it's something like the OPD, normally our OPD have say 30 patients per day. We know in an hour we get around 2 to 3 patients, something like that. But suddenly patient starts now within in an hour 40 patient lands up. What do? You are totally, your system goes for a 6 and then it becomes a difficult to manage those situations. Saying 40 patients in a day, once in a while it is okay. So but if you get a 40 patients every hour in on a daily basis, you require additional manpower or you have to work extra. You will not be able to dedicate that time to your each and every patient. Similar things happen to our liver. So when we eat, when we consume purified proteins, there is a sudden high increase of amino acids in the blood and liver doesn't know what to do. It has to, so it will be stress. So most of the chronic diseases which we see today are as a result of chronic stress, not to us, it is our liver and pancreas. Now second thing, when we eat a whole food like we eat egg for protein, it provides amino acid in a very slow manner. It's like a OPD, one or two patient coming every hour. Second, there are other non-protein foods like micronutrients, carbs, fats, which help in slowing down, as well as these micronutrients can be utilized in processing of these proteins. But when we take highly purified amino acids, there is no micronutrient available in the food to process these proteins. So these, from where these macronutrients comes up? These will be taken from the body stores. So chronic use of anything which is purified will also have effect on the micronutrients. And another myth which is there is protein causes calcium loss. Latest research shows that this is again a myth. Old belief, yes, they thought that protein leads to calcium loss and osteoporosis, but current evidence says that protein increases calcium absorption. Number one, more calcium is observed in gut, more in urine, not from the bone. Protein improves bone density because protein is a basic material for collagen, and collagen is what the matrix of the bone is laid, and protein strength muscle. So these are all myths. There will be many more such myths, but I was able to find only these myths as far as protein is concerned. So protein, adequate protein in the breakfast or food adds to the satiety. Carbs in opposite, carbs causes hunger. Adequate protein diet will help you to lose weight, treat all chronic diseases, and youth will be maintained. If you can take adequate amount of protein, you will remain functional till very late age. Now these are two doctors. One is Dr. Jeffrey Life. You can see here his profile. He is 85 years old, and he has improved, of course, with exercise and high protein diet. So we have to choose that what we want to eat: 300 grams of satiety, 300 calories of satiety, or 300 calories of hunger if we take a high protein, high carbohydrate breakfast. So proteins, the takeaway message is that protein is the elixir of youth. It is very, protein deficiency is very common, and our diet must be rich in protein, not in carbs or calorie or so. Leave calorie, leave others, cater for protein first, other can follow. And we have to eat complete proteins in all meals, real foods or whole plant food, not processed. So in my opinion, proteins is a magical macronutrient. So again, message to all of you: count your proteins, not your calories. With this, I have completed. I think I have completed, and now we can take down questions if any